First of all, thank you so much, Mr. Antonio Azevedo. Antonio Azevedo is a lawyer specialized in compensations in cases of accidents. So let's talk a bit about this topic, bearing in mind these special times we are facing right now with a COVID-19 pandemic, of course. So first of all, my question is, how is your office performing during this pandemic?
Well, just to be clear, I don't want your listeners to be confused. We do not specialize in workers' compensation. We don't do workplace accidents.
Okay, of course.
We do car accidents. We do, falls on someone's property or on the sidewalk, and we do disability claims. Now, to your question, our office is generally closed to the general public. We have two doors to the entrance, but we will see clients by appointment. And we have certain precautions in place. We have masks, we have gloves, we have hand sanitizer. So if we do need to meet with someone person to person, we can do it. And we can also at the same time maintain 6 feet of distance. We try to do as much as possible by video conferencing online or by telephone. We really can do a lot that way. And usually with the people who are very comfortable with computers, we can do it all by video conferencing, by telephone or online.
Okay. Do you have any kind of selection of the cases? For instance, if you see that some cases has more emergency, you will probably prioritize it or meet in person, maybe?
Well, if we get a case, for instance, recently we had a case where a woman was very badly hurt and she was in a rehabilitation hospital. That type of case, we need to get on because she needs care. So they need attendant care. That kind of stuff cannot wait. And even if you're not seriously hurt, we don't have to wait for new cases. We can proceed. The courts are not working in the same way. So, I mean, anything that has to go to trial, civil trials are postponed. I mean, most cases of personal injury don't go to trial these days anyways. So that's a small concern for us.
Yes, but would you say that the COVID-19 has changed this type of legal processes of compensations?
No, I wouldn't say I mean, the only thing that's really changed is the person-to-person contact. That's the only thing that's really changed. We continue to function, we continue to operate, and the only thing really we have to be careful with, of course, is infections, that's really the only thing we have to be careful with is person-to-person contact.
Okay. I would like to talk a bit about the possibility. I don't know what you will answer, but I'm curious about it. The possibility of compensation in case of contagion. If there's evidence of negligence, for instance, let's say, imagine an infected person that is not cautious enough, doesn't wear a mask, doesn't keep social distance, and infects another person. Is it possible to ask for compensation?
That is a very interesting question because the courts have quite a complicated process for establishing new torts. Okay. Now, if the person knew they were infected and if they intentionally did not take precautions, not caring if they infected other people, then I would say there was a very good argument for compensation. Of course, many people with COVID-19 do not know they're infected because they can be asymptomatic. In such a case, would a court find that if they fail to wear a mask or take precautions, that is negligence amounting to something that will be compensable? That's a very difficult question, and I would want to look at all of the facts of that one. And us lawyers, we only give our opinions. We're not judges. So sometimes on those difficult ones, those are the really difficult ones that end up in court sometimes when there's no clear answer.
But do you have any knowledge of a case like this? Are people doing it?
Not yet. I do remember some time ago. It's been a while since I read those cases with HIV infections, but that was a long time ago. HIV is no longer a prominent issue like it was in the past, but certainly if the person knows that they're infected and they're reckless or careless, I could very well see a case for compensation. The problem with COVID, though, is probably the majority of people, based on what I have been reading, who are infected are asymptomatic and don't even know that they're infected. So that's the big problem.
So maybe in those cases, like the rules should be more strict. Like even though if you don't know if you have the virus and you are asymptomatic, you should always have be careful and wear masks, etc., etc. That maybe could be a way of proving if the person was negligent or not.
Yes, that is another factor. One of the considerations that would be taken into account, for example, would be if the public health officials in the government came out and said, okay, everybody needs to wear a mask now to prevent the spread of infections and makes it mandatory, and you do not wear a mask, then that would be another step towards negligence and compensation. But of course, one of the starting points of tort claims is causation. If you meet someone who's not wearing a mask, how do you prove that that person is the person that's infected you just because they didn't wear a mask? So it's creating these new torts. Boy, it would be difficult.
Complex.
Yeah,
complex.
but sure, there would be possibilities, no doubt.
Yes, and for instance, I don't know if you would agree with this vision or not, but maybe some professionals, like health professionals, for instance, should be held more responsible if this happens, if they infect someone, and in that case, maybe the compensation should be higher.
Usually the amount of compensation based on negligence is calculated based on how much the victim has suffered. Sometimes the compensation could be higher if the person who suffered, who inflicted the injury, did something bad, like it could be punitive or aggravated damages. But I cannot see a healthcare worker being held responsible for infecting someone. There would have to be some serious consequences because this is so new, this virus. So what would be the standard of care? Mm-hmm. And they would have to fall below an established standard of care. It's really a very complex issue, but I will not be surprised if some lawsuits are commenced after this, especially around nursing homes, because something seems to be happening in the nursing homes of Ontario where the rate of infection seems to be much higher than in hospitals or elsewhere. So I could definitely see some lawsuits coming out of infections at nursing homes.
Yes, like the residents asking for compensations because of maybe lack of care regarding the. That's what you mean, right? Or even the workers.
Yes. Also, for example, I can see cases. I mean, the government. It took the public health officials and the government a while to figure out. Here's an example that workers were working often at more than one nursing home. So they figured the reasoning was that these workers who were working at more than one different nursing home were spreading infections. That was one of the ways that the infection was hitting nursing homes. Now, if the government said, which they did, after you have to pick one nursing home and you can only work at that one nursing home after whatever the date was. If after that date, a worker continued to work at different nursing homes, and the management of that nursing home knew that this person was working at different nursing homes. And because of that person, some of the people in the nursing home were infected, then yes, I could see a case for compensation.
Yes. And do you think there's a chance of that person winning the case? Now.
No, with the facts that I just outlined, there would be a chance, yes.
Okay. So maybe this coronavirus can open a new chapter of the possibility of compensations in case of contagion of diseases in general.
Yes, it wouldn't be something that I would do because that's more like a professional malpractice area, and there are lawyers that are specialized just in that area.
Mm-hmm.
Okay, I'm more of an accident lawyer, although I have done some professional malpractice work in the past.
Okay. I don't know, maybe you could answer the question, even though if it's not your area of specialization. But in Portugal, there are already insurances that protect companies if employees get infected by COVID-19. One of these insurances, for example, provides compensation to the company in the case the worker is hospitalized in an intense care unit. Is this happening in Canada? Are you aware of this kind of insurances?
No, I'm not, but that's not my area. I do know, for instance, that there is partnership insurance for instance, not employees, but if one of your partners dies or something like that happens, there's insurance coverage for that. I mean, it's a big business insurance. You can insure almost any risk.
Yeah.
And it just depends on, the risks and the amounts. And
Yeah.
I'm
So
sure,
this coronavirus can be an opportunity for the insurance companies.
yes, and you've noticed it works the other way too, right? With the
Hmm.
car insurance companies offering to give refunds back to drivers because there's many fewer cars on the road. People are not driving on the cars. So some car insurance companies have stepped up to the plate and recognized that the risk of accident is much lower during the COVID crisis. So they're offering to give money back to their own clients.
So regarding your practice now, with this social isolation rules, have you seen a reduction in complaints related to accidents?
Yes, uh, definitely. There are fewer cars on the road. There are fewer accidents. There are definitely fewer calls for new files for new accidents, without a doubt.
So this has affected your business, I imagine.
Yeah, it won't really affect, I won't feel that until 2 years from now, because it takes an average of 2 years, sometimes more, sometimes less, to resolve an accident file. So for example, the files we are settling now for our clients walked in our door 2 years ago. So our firm is definitely feeling an effect now, but we will probably feel more of an effect 2 years from now.
Okay. But of course, this social distancing also reduces the risks of accidents because people stay at home, so they are not as at risk as they should be in the normal life, of course.
Yeah, one of the things that could happen is there could be an increase in disability claims because the social isolation, the staying at home, can be challenging from a mental health perspective. So that could, in my 30 years of doing personal injury cases, what I found is that if the person suffers from anxiety or depression or trouble sleeping, it complicates the recovery of any physical problems. And it always makes it more complicated. So there could be an increase in disability claims.
Okay. I just remembered I read an interesting article today that says that the stunt driving fees and have also increased. People are, I don't know, not using the car as much, but they are stunt driving. So maybe that could also be the case. More car accidents because of stunt driving. What do you think?
Well, it's probably the younger people with more space on the road. You know, in the city, you can't usually stunt drive because there's too much traffic. Usually we see that late at night on bigger roads or in the highways, but now it's probably happening more often because the young people are bored and there's more space on the road.
Mm-hmm. But you talked about this the mental health eventual rise. Do you think any other accidents could rise because of this pandemic?
No, I haven't seen it yet. It's very possible, but I haven't seen it yet.
Maybe it's too early to
Yeah.
watch that tendency. Okay, so let's forget the pandemic for a bit and talk about the risk of accidents in general. Regardless of this moment we live in, what should be the first attitude a person involved in an accident should take?
You mean like a car accident?
For example.
Yeah, well, the first thing is your health. And then the second thing is make sure you get the information of the other driver. If you have a phone or someone in the car with you, can take pictures of the accident scene, the cars, gather as much information as you can.
Hmm. But then also one of the steps should also call a lawyer as yourself.
Yeah, if absolutely. If you're hurt in the accident and you're missing time for work, or even if you're not missing time from work, but you're seriously hurt, you after you've seen the doctor or gone to the hospital, you should definitely call a lawyer. Most insurance companies are not too bad, but they're not there to look after you. They're there to make money. So they always try to work things to their benefit, not to your benefit. So it's really good to have a lawyer watching out for you.
Okay. Can any type of accident justify a claim for compensation? If a person, for instance, falls down because of the snow, can he or she get a compensation?
Well, I often have to tell people this, okay? A lot of people fall and they're not entitled to compensation. You know, if you're walking along the sidewalk and you trip on your shoelace and you hurt yourself, it's your own fault. You cannot sue anybody for compensation. In order to receive compensation, someone else must have been negligent. Someone else must have been so negligent that it caused you to injure yourself. Then you can get compensation. So the falling because of snow is, it seems like a very easy question, but it depends where you fell. Because if you fell on city property, the law is one way. If you fall on private property, it's a different law. So the legal tests are different depending where you fell.
Hmm. Usually, what kind of cases do you receive more? Like, what's the most frequent accident and that justifies compensation?
Well, it's mostly car accidents,
Mm-hmm.
but we also do a lot of falls on sidewalks. Usually, the more serious cases, and some of them are quite interesting, believe it or not. Like, for example, um, in the winter, most people think that if you fall on the sidewalk in front of someone's house because they didn't clear the snow off the sidewalk, most people think that the homeowner is responsible, but that's not the case. The sidewalk is belongs to the city. If you fall and you hurt yourself because of snow on the city, it's the city responsible, not the adjoining homeowner. The city can give you a bylaw ticket for failing to clear the snow, but that doesn't make you responsible for someone falling on the city's property. Now, the homeowner can become responsible if they try to clear the snow, but they do a bad job and they put it very high in the middle of the sidewalk, or I've had one of my favorite cases is um, someone extended the drain from the roof eaves for the drain of the water, and that it came right through the front yard underneath the ground and emptied on the sidewalk. So the water and the sidewalk was not flat; it was a little bit level. So in the winter, that piece of sidewalk was always icy
Mm-hmm.
because the water would come and freeze on the sidewalk. That's a classic case where the homeowner beside the sidewalk has created responsibility for themselves because of what they did. But
Mm-hmm.
normally, for instance, you fall on the sidewalk because of snow in someone's home. The city's responsible, not the homeowner.
Yeah, it's interesting because you see the seasons have also an influence on the number of cases, right? Like during the winter,
Yes.
you probably have more
Yeah.
cases, s-
Yes.
exactly because of that.
Yes, absolutely. Yeah, and because of the not only that as well, but the often the winter will move sidewalks, and there'll be differences in elevation. So even though it's spring or summer, it's the winter thaw and freeze that created an uneven surface. So you have to be careful with that as well.
Hmm. So my last question is, what advice you would like to give people in general and in our Portuguese community in specific in these during these strange days?
Oh, just be safe. That's probably the most important thing right now. Worry about your health. Maintain 6 feet of distance, and I know it's frustrating. It's frustrating for all of us, but just wait for a better day and just be safe. That's all. That's the most important thing right now.